reckoning is finally here. No justice, no peace for too many years. We're marching for equality in every state.
Welcome and hello, everyone. My name is Celia Castleman. I'm a member of the advisory board of the TomTom Foundation and most recently the director of programming and events at Vault, Virginia. While that work is on hold, I'm chief operating officer for my household, wrangling 3 children. I'm proud and impressed with how the TomTom organization pivoted and created a new format for the festival during the pandemic. On behalf of our board and our team, I want to thank each and every one of you for being here. Today's event is part of a 7-week virtual event series called the Cities Rising Summit. Cities Rising will explore critical issues surfaced by the COVID-19 pandemic, especially as they relate to small and mid-sized cities in America. All Cities Rising events will be available on a pay-what-you-can scale thanks to the support of our sponsors and community members like you. If today's program resonates with you, please consider becoming a contributing member to the foundation. You can do so on our website, tomtomfoundation.org. Any donation you make is tax deductible and helps ensure that we can continue to do this work in the months and years to come. The Cities Rising Summit will run until October 30th, and we encourage you to get as involved as possible over the course of the coming weeks. Join us at weekly meet and greets and interactive changemaker sessions. Connect on our Slack workplace, and please email us at any time with your questions and feedback. All talks will be recorded, so if you enjoyed today's session, please feel free to log on to our YouTube channel and share it with colleagues and friends. Please note the chat function in the bottom right corner of your screen. You can use that to ask questions of our speakers, share your lived experience around these issues, and connect with other participants on the call here today. Also, please note the Q&A function. Our moderator will have their eyes on that channel and will include your questions and insights and how to steer today's conversations. The title of today's talk is Vital Signs, the urgent call to build healthier communities, and features our Virginia State Health Commissioner, Dr. Norman Oliver. He probably does not remember, but he was my very first doctor when I moved to Charlottesville 7 years ago, and I think he'd be very happy to know I've already gotten my flu shot. This event is part of a week of thematic programs around health equity and is brought to you by the Hartfield Foundation and Goodstock Consulting, who we thank for their incredible support and collaboration in building this program. With that, I am pleased to introduce you to our moderator for today, Anton Gunn, a leadership development consultant at his own 937 Strategy Group, as well as former senior advisor to the Obama administration and the current Chief Diversity Officer and Executive Director of Community Health and Innovations for the Medical University of South Carolina in Charleston. Anton, I'll turn it over to you.
Thank you very much, Celia. I really appreciate that warm and wonderful introduction and how you set the table nicely for all of this. So good morning, everyone. For those who are watching via Zoom and as a part of the chat, I want to make sure that we use the chat function as much as possible to have maximum engagement in this session. If you're watching live on YouTube, you all can converse there as well. We want to make sure this is a robust discussion and a dialogue around the vital signs that we need to build healthy communities. I first want to say it's a pleasure to be here with you. I'm actually a native of Virginia, for all of you who are chiming in from Virginia. My family roots go back in Danville, but I'm a native of the Hampton Roads area, being born in Portsmouth and graduated from high school in Virginia Beach. So I'm a 757 kid all the way through, but currently call South Carolina home, and Charleston is where I live today. And I'm just so excited to be with you, and this is going to be a robust discussion. It is now my pleasure to introduce Dr. Norm Oliver. Prior to his current appointment as the Virginia State Health Commissioner, Dr. Oliver served as Deputy Commissioner for Population Health for the Virginia Department of Health. Before accepting that position, he was the Walter M. Stewart Professor and Chair of the Department of Family Medicine at the University of Virginia School of Medicine. And Dr. Oliver has helped lead transformation of the department's clinics and sites into patient-centered practices focused on population health. He's done an incredible amount of work across the state of Virginia, and improving population health is an important priority for him. He believes that it requires addressing the health-related social needs that affect all Virginians and everyone across the Commonwealth. So today we're going to have a robust discussion that is his perspective about what we can do on these difficult days that we have in front of us with the coronavirus, with racial unrest, structural racism, the whole economic calamity of millions of people being out of work. What can we do to build healthier communities? So I would like to say good morning, Dr. Oliver. It's good to see you again, and happy to be with you. How you doing?
I'm doing great, and good morning to you, Anton. Thank you for that very kind introduction. Yeah, we're living through some very difficult and uncertain times, and I believe that hopefully in this discussion today we can give some ideas about how we might tackle those times.
Well, yeah. So I want to start with something, and I know people probably have seen your bio, they see your name, but they may not know you, and so I've gotten to learn a little bit about you, and so could you start by telling people what's your hometown? Where'd you grow up? What do you identify with as home?
I grew up in Detroit, Michigan, so right in the inner city there, right around people know Detroit at all. It's West Grand Boulevard, right in the heart of the inner city.
Fantastic. Great to be with a Detroit native, and good to talk to you. So as we start this conversation, I want you to really just kind of expand and help people, because I don't want to assume that everyone listening today has a command of the facts, that they have a narrative around what do we mean when we say building healthy communities, or why we even need to build healthy communities. We know we're seeing unprecedented disparities in COVID outcomes. We're seeing disparities in job loss. We're seeing disparities in how people are treated by law enforcement in all kinds of encounters and what they're doing. So I want to start with the word health disparities. And so what is a health disparity? How do we define them? And what should people know about that term health disparities as they look around their communities and they look around their daily lives?
I like to make a distinction between health disparities on the one hand and health inequities on the other. A disparity is just that, it's a difference, right? So there's a difference in the amount of breast cancer between men and women, right? Far more breast cancer in women than there is among men, although men do have a small amount of it, right? That sort of disparity may be just strictly based on biology. Inequities, however, are really just a reflection of social inequities. It's something that shouldn't be there. It's not based in biology. And what we see when we look at the African American community, the Latinx community, actually some of the differences we see between men and women are not because of biological differences, but because, as you mentioned, structural things like racial discrimination, the poverty that exists in a particular community, which is not, again, a biological function, but something that is really designed and in the fact that those communities are disinvested in. There's no places for good jobs. Educational achievement isn't as high, but that's because the educational system isn't really fostered and resourced well. So those sorts of things set up social differences, inequities, that then lead to health inequities. And that's what we have seen in the African American community and other communities of color. You name the disease, diabetes, heart disease, a number of cancers, stroke. African Americans will have twice as much in terms of the incidence from that, and also twice as much with the mortality, in terms of mortality. So we're dying younger and dying in disproportionate numbers as a result of the social inequities and racial discrimination, the systemic structural racism that exists in the society, which gets reflected not just in health, but as you mentioned, police violence against our communities and in other ways as well. So in order to really, and just from a health point of view, in order to improve our health, we have to deal with those issues of structural and systemic racism and part of building a healthy community is eliminating those problems, and then the community as a whole will be much healthier.
Well, that's a great place, and you've just kind of given me so much to try to unpack and dissect, and I want to make sure that we dive into this. So for everyone who's watching, if you got a question, please use the Q&A and help inform this process. I'm a big crowdsource kind of guy, so I want to make sure we have the opportunity to crowdsource as much of dialogue that we can around these issues. So you talked about the difference between disparities and inequities, and that inequities are driven by a social context, if you will. And I really do find that people don't necessarily see these terms as different. They kind of sometimes lump them all together and says, oh, disparities are bad. And yeah, on its face, if women are getting breast cancer more than men, that would be bad. But you know, there's a limited amount of things that we can do about it without really changing people's biology. But when it comes to inequities, there's a lot of things that we probably could do differently to address that. So the term health equity is one that we know we're starting to hear a lot more and more about in the lexicon of, you know, the discussion around how do we deal with disparities that are not necessarily biological, but are more social and structural. So when you hear the term health equity, what does it mean to you? And how can people process, how do we close an inequity, or how do we close the gap on an inequity and make something more equitable? And is there a holy grail, if you will? How do we know that, you know, we've done enough, if you will, on this conversation? Because I know people are quick to say, if the disparity is 4 times, if you cut it to 3 times, maybe you've done enough. Or maybe we need to flip it on its head and make the disparity go in the opposite direction. So how would you break this up? How would you kind of frame this up for people to think about what do we do to achieve health equity?
I think there's different levels of approach to this. As someone who trained as a family doc, I start off at the level of how do I deal with that patient sitting right in front of me. And the inequities that they face get presented in terms of their own health-related social needs, right? So I'm sitting there and I'm talking to them about their hypertension, but you know, they're also struggling with the fact that they don't make enough money to put food on the table in a regular way, and they and their family are food insecure, right? So and that's having an impact on their hypertension. So in order to deal with just their hypertension, I have to do something about that health-related social need. I need to figure out a way to help them get food on the table, right? So I think clinicians and healthcare systems, clinics, and so on need to connect with social services and others in the community so that that health-related social need on an individual level can be met. Now, when I talk about that, that's just the individual level, right? If you take it up another notch, why is that person food insecure? Mm-hmm. Well, you could say they live in a community that's a food desert. Food deserts don't just happen, but let's just leave it at that level. There's a food desert. Maybe we can do something on the community level to help resolve that problem. You know, pull together businesses, community-based organizations, faith-based organizations, philanthropies, that sort of thing. Build a community garden, develop a store that provides nutritious food at a reasonable cost, that sort of thing, at a sort of community level. But you can take it up an even higher level, because food deserts, as I say, don't happen by accident. Communities that are impoverished, that's not driven by some natural thing. Those communities were actively disinvested in. And that speaks to broader policy sorts of issues that we could address. And that takes it to a whole new level. And I think we have to deal with all three. At the clinical level, deal with the health-related social needs. At the community level, do something about building community infrastructure together with all the various stakeholders within the community. And at a societal level, develop policies that reinvest in these communities.
That's a great kind of a three-level approach. Now, you know, I heard you talk about the individual level and you as a clinician, what you were able to do, and also a little bit at the secondary level around, you know, a food desert, if you will. So I want to ask, like, whose responsibility is this? And, you know, working in academic medicine or working in healthcare in general, you know, some people will tell you that they believe that this is the hospital's responsibility to make sure that we address those individual inequities, if you will, and achieve equity for those individuals. And some even say because hospitals are many times the largest employer in a community, that they have a disproportionate responsibility there as well. So my question to you is it hospitals' responsibility to deal with these issues, to address the inequities, or is this somewhat of a broader health ecosystem? And what does that look like? What's in that health ecosystem, if you will?
I think hospital systems, healthcare systems can play a huge role in addressing these issues, but they're not the solution to the problem. I found actually in my experience in working in the healthcare industry is that the prevailing thought is actually that that's not our responsibility. And that was the big fight that we all have. Actually, we do have a big responsibility here in dealing with that, even from the narrow point of view of the board looking at the margin that the hospital's making, right? Even from that point of view, you got to deal with these problems, right? Let alone from the fact that it's the right thing to do for the people that we serve. So I think hospitals play a big role. When you look at the difference between a community's current state and where that community envisions itself to be and wants to be, there's a huge gap, right? And there's some assets that the community has, and that's good. I think we need to start from an assets kind of view instead of just saying, oh, the community's impoverished. Well, we got a lot of assets too. So you start with those assets, and then what happens in that gap between where we are and where we want to be is you have all kinds of organizations working to close that gap. You got faith-based organizations, community-based organizations, local government, state government, philanthropies, you name it. They're all working. What historically the problem has been is that we're all doing our bit on our own and not making a whole lot of difference in terms of closing that gap. I think the big thing we need to do is to get all of those organizations together, working together and mutually reinforcing each other's activity. And when we do that, we'll make significant strides in closing the gap. And that's where I think institutions like the healthcare systems can play a big role. Take an example like we were talking about earlier, food insecurity. Healthcare systems are required by the tax code to look at the health needs of the communities in which they serve, and to contribute significant amounts of money, millions of dollars, to help deal with those issues. They could use that money not to solve the problem, but as a way to sort of leverage others. You could get a contribution from that, and then they could get other businesses together and community organizations together and begin to do something about food insecurity, or the lack of affordable housing would be another one.
Well, that's all, so much you said in there, what we all can be doing. I want to talk very quickly about social determinants. And, that's another term that people are starting to use a whole lot more today, and say, what are the social determinants of health and how is that connected to building a healthy community? Can you speak a little bit around, from your vantage point, what are the social determinants that are the most pronounced, that have the biggest impact on health? And, what can a system or health system, if you will, as you talked about earlier, do to kind of address those social determinants? What does that look like?
Right. So social determinants of health are those broader social, economic, even cultural factors that are the framework in which, the way I like to look at it is actually to avoid the term of social determinants of health, because a lot of people really don't know what you mean when you say that. I think of it in terms of it's the framework or the environment in which you live, work, play, pray, all those things, right? And that environment shapes your physical health, your emotional and mental well-being. All of those things impact that. And to the extent that those factors are nurturing and supportive, then your physical health and emotional and mental well-being is improved. And to the extent that they're not, then it's a detriment to your physical, mental, and emotional well-being. Jobs and the ability to put food on your table, provide other resources for yourself and for your loved ones. Education, closely related to your ability to get the jobs that we need in order to survive. Whether or not you have insurance and what type of insurance you have, since that really can be a roadblock to your accessing healthcare of any sort. Transportation can, particularly in rural areas, but it's also true even in urban areas, right? I mean, one of the reasons why we talk about some communities having food deserts is, well, there's nothing there. And to get to some nutritious food, you gotta be able to drive someplace. And having transportation can be a problem. Housing is a huge one. Now, the Virginia Department of Health has something we call a Health Opportunity Index. You can go to our website and check that out at vdh.virginia.gov. And in that Health Opportunity Index, what we do is we map a number of different factors in about 31 different factors, including a number of the things that I just mentioned. And you can see at that, we can get that right down to the census block level. You look at that map and you can see communities that are completely impoverished in all of those areas, or multiple of those areas. And those are the same areas where we see the worst health outcomes. At this point, we just sort of have a, what's the word I'm looking for? Just a correlation between those things. I can say, well, whenever the health opportunity index is really low, it seems to be associated with poor health outcomes. One of the things that we're working on is a more predictive model. This is getting to the specific answer to your question. We're looking for a more predictive model where we could say, it looks like the most important factor in this particular community is housing. And if we were to deal with housing, if we could improve the amount of affordable housing by 30%, we could decrease infant mortality by 5% or whatever, right? I'm just making those numbers up, but that's where we would like to hit. So it's not, right now we know that if you improve the amount of affordable housing, health will be improved. I'd really like to quantify that. So I could go to my local legislator and say, hey, did you know that you could prevent the death of X number of your constituents by building some good affordable housing in your district?
Yeah, that would be powerful. As a former legislator myself, having that kind of data will compel you to do things differently, to make different decisions. And so I'm so glad that someone put the Virginia Health Opportunity Index into the chat so people can see where that is and people can do some more research in that space. You also said a social determinant of health could be cultural. And I'm going to ask this question, and this is kind of a little bit deeper dive around where we are with COVID right now. We all know that there is a race towards a vaccine and actually coming up with a vaccine so that we can get beyond the coronavirus, this novel coronavirus that we're facing. But some people will say there are some cultural reasons why that even if we came up with the perfect coronavirus, we still would have some disparities, and we would also have some inequities in terms of outcomes, particularly in the African American community. So could you talk a little bit around what some other cultural challenges could be to help that would hinder us from closing a gap on inequities, if you will, because of how people think about things or what they believe about things or what people past experiences may have been, particularly for people of color in indigenous communities who generally may be distrustful of the medical system. So are there other things like that that could have an impact?
Yeah, I want to talk about this cultural issue from two aspects. One, in terms of the African American community and other communities of color. There's a tremendous distrust of the healthcare industry, of the government, of large corporations, and this distrust is well earned. The history of what's been done to our communities, including by public health, by the way, like Tuskegee was a public health experiment. People have a justified mistrust. That plays into the low uptake of things like vaccinations. So if you look at flu vaccinations, we're about to hit flu season. In the African American community, maybe 40% of the community gets vaccinated for the flu each year. And that's as opposed to maybe 60% in other communities. Now, I'm not one for blaming the African American community for that, because as I said, I believe that mistrust is there for a legitimate reason, which means that it's the responsibility of the healthcare industry and public health to explain in terms that are easily understood by folks, and through our actions to demonstrate that what we're doing this time around is actually in the interests of the community, and to partner, I think, not to fool ourselves in thinking that, well, everybody's going to trust me because I'm the state health commissioner, right? We need to join with trusted leaders in the community. Trust is something that gets earned. You don't. It's not just given. So there are already people who are trusted in the African American community or in the Latinx community. So we need to partner with them to get that message out, and that will help get rid of that inequity in terms of vaccination. And that's going to be really, really important with COVID-19, because on top of that already existing problem of the mistrust, this whole vaccine thing for COVID-19 has been completely politicized, right? So it makes it, I'm convinced the distrust is even higher around that than it is around already established vaccines. The other aspect of the cultural thing that I think is important is to recognize that the healthcare system itself and clinicians within that system have their own cultures and cultural biases, and I would argue racial biases, usually not explicit. I mean, thankfully, since the civil rights movement, the number of people who are consciously racist, explicitly racist, is a minority. But there's a lot of unconscious, implicit sort of bias there, and that impacts the kind of care that gets delivered. And so that's the other thing we have to deal with.
Yeah, well, I really appreciate you going there. And actually, I got a question from Kelly that's kind of related to where you just finished up. The American Public Health Association recently hosted a webinar titled Race. the ultimate pre-existing condition. You know, what's your reflection on this title, and how can we help this reality resonate with the white communities and allies to make sure that we mitigate the impact of race as a pre-existing condition?
So it's my first reaction to that title is I didn't like it. The getting to the implicit bias stuff. What's implicit in that statement is that somehow race is when you talk about pre-existing conditions, you're usually talking about some biological thing, right?
Mm-hmm.
And race has nothing to do with biology. There's one race. It's the human race. It comes in all kinds of shapes and colors, but there's just one race, right? Now, so I think race is a social construct. It was developed by our enslavers as a way to excuse what they were doing to other human beings. Mm. So race doesn't exist. Racism is real. Racial discrimination and the institutionalized systemic racism that exists in this society and others is very real. And that's the pre-existing condition that we have to be dealing with. If that's what was done on that webinar, then I'm happy that APHA did that. I know a lot of people in the APHA who would in fact make that argument. So we got to deal with racial discrimination. Police violence is a public health issue. We have to deal with systemic racism and the whole way our society is structured. And I think if we do that, we'll be addressing that thing. Now, some people will use race as a sort of, they'll say race and mean those other things. Mm-hmm. But I think it's better just to be upfront and talk about the things you actually mean and not use the race, because the problem with that is that you can easily slip into thinking there's something biologically off with Black people or Latinx folks, because, why else would they be so sick?
Right. Yeah. And someone else, Maggie, just commented that she think the webinar was actually titled Racism, the ultimate underlying condition. And I think that supports completely what you're saying, is that racism is the underlying condition. And of course, race is a social construct and definitely not biological in terms of a debilitating thing in any way, shape, or form. Now, we've kind of unpacked the problem, if you will, of disparities and inequities and social determinants and how these things play themselves and have an impact. And we've hinted a little bit around some of the solutions to some of these challenges and who should be accountable or involved in doing them. And I'm really interested in what you all are doing in the state of Virginia, my home state, and just what's Virginia's plan for well-being. So we're talking about vital signs. How do we improve the health of the community? I've seen this reference multiple times, Virginia's plan for well-being. Could you talk a little bit about what that is and how people should think about well-being, and what are the opportunities that we all have to help make an impact in that space?
The Virginia Department of Health has this plan called the Virginian Plan for Wellbeing that looks at 4 big buckets of where we need to make interventions to ensure the health and well-being of all Virginians. It starts off with what we're talking about here, with building healthy, connected, resilient communities. And I believe that is one that you can only do that through this sort of health equity lens that we've been talking about, where you recognize the structural problems of racism and other forms of discrimination and exploitation. And you got to deal with that and have a healthy, connected community. And then if you look at the cover of that Virginia Plan for Wellbeing, it has a picture of a tree. It's a cartoon of a tree. And the bloom of the tree, the greenery, is what we are looking at as being the healthy well-being of the entire Commonwealth, right? So it's rooted in healthy, connected, and resilient communities. And the trunk that provides life for that is a strong start for children. You need healthy, connected communities to have strong, healthy children who are the basis of being, you know, if you don't do that for your children, you can forget having a healthy state, right? So strong start for children. And then the big branches on either side that support the foliage of that tree is, on the one hand, is preventive care. It's much better to help you not get heart disease than to be treating you for heart disease later on, right? So we need a really strong preventive care system. Primary care and public health, I think, is really critical to providing the health and well-being of the entire state. But we also need, importantly, systems of care. And that's where I think of the healthcare system. Acute care hospitals are really important. You know, one of these days, you know, something serious is going to happen. I'm going to have a stroke or something like that. And I want a really fantastic medical center right there to take care of me, with a great emergency room and all that sort of thing, right? All too often, however, if you look at the healthcare systems, or rather the government's focus on healthcare is limited to that one branch, right? Probably 95% of the investment goes into acute care, all that fancy, high-tech, tertiary, quaternary care sorts of things. And we need a lot more. We need to shift that. So preventive care, primary care, care for children, and resources and support for the communities is what we need. Is what we need in order to really provide for the health and well-being of everyone. Sorry about that. I don't know what that is. I can't hear you.
Oh, I'm sorry about that. So you kind of gave us a great image of that tree. You got the roots of the tree, mm-hmm. You got the trunk of the tree, and you got the branches. And so a lot of people think of the branches as the most important thing on a tree, but we all know the root system matters. If the root system is trashed, then the whole tree is trashed, and you can kill a tree from the roots on up. And so thinking about the roots, you know, healthy, resilient communities, it really speaks to the social determinants you talked about, like, exactly. you know, children being, I mean, the children are your foundation, but, you know, jobs, housing, transportation, access, all of those things kind of make it simple and easy for kids to be able to grow up. Like, I can't grow up healthy if my parents don't have a job and don't have good money to put food on the table, if we don't have a safe, affordable home to live in that's free of violence and free of everything else. So I really see some, you know, good assessment and symmetry around what those things should look like. Now, what I would like to think about it in each one of those pieces of that tree, if you will, maybe we start with the roots. What should individual citizens, so like, yes, maybe I'm you know, I run a bank, or let's say I'm a banker, or I'm someone who has the ability to help out in the community, but maybe I don't have that title and I'm just a John Q citizen. What can I do to help build a health ecosystem that is strong, the way that imagery of the tree is? What should I be advocating for? Besides being educated and being more aware of these important stats, is there anything I can do to help? And that question comes from Paul, who wants to know, you know, what can I do if I'm an individual community member to help make sure this, you know, plan for well-being or this health ecosystem is strong?
Well, thanks, Paul, for that question. And it's a very important question. I believe that there's things that individuals can do. And most of us are more connected than we realize, right? Individuals are part of families. Families are part of a community. You're involved in your church or mosque, or you're involved in some other kinds of social groupings. And I think through those means you can partner with others, so that it's not so much that you as an individual do something, but you along with others like you can do something. And we've seen a great example of that in the last several months, right? People, perhaps it was because we were already at wit's end with COVID-19, and George Floyd happened, and that's it. That was the straw that broke the camel's back. And by the end of the series of protests that happened around that, there were millions, literally millions of people had taken to the streets, right? I believe coming together as individuals, but then joining with other individuals, we build a movement that can actually change things. And I think we're seeing that around the fight against police violence. We've seen it historically, right? With the civil rights movement. I'm a child of the 60s, so I remember that quite clearly growing up in Detroit. There were literally hundreds of thousands of people out in the streets demanding our rights, and things changed significantly in this country as a result. I believe we can continue to do that. So Paul, get together with others like yourself and take some action to really push things forward.
Yeah, that's a great answer. And you actually just kind of hinted at two things that there were a couple of questions that came in about that I kind of want to dive into and just kind of get your points on that. So, child of the 60s, growing up in Detroit, I'm pretty sure you remember the riots in Detroit and what was happening in the streets in so many other cities. We're seeing that play itself out over again. And the backdrop of that is still this pandemic of COVID. That'd be like people knowing that they could get sick or get hurt by COVID, or maybe even die from COVID. People were still showing up, demanding something to be different. And so the question is, and this kind of comes from David, and I'm going to pivot this into a couple other things that came up. Is COVID and this kind of current environment raising the awareness of investing in public health and shifting away from that acute care to those other branches that only focus on, how we got the best tertiary, quaternary healthcare system and the best robots in the hospital to deal with you when you're in this crisis state after you've been sick for 45 years with this problem, versus investing in how we build healthy communities, sidewalks and bike trails and, physical activities and fresh fruits and vegetables. So do you feel like that, because we know COVID hurts people worse who have pre-existing conditions, and that if you don't have any pre-existing conditions and you get COVID, there's a chance and a likelihood that you may not suffer as bad as some of the outcomes have been for other people. So do you think that we're seeing a monumental shift because of all of what's going on, or is there still more work to do to raise this awareness? And I'm kind of asking because you run the Department of Health in Virginia. Did the legislature stroke you a big check this year for you to do 10 times the work that you're doing? Or did they expect you to do more with less, the way most governments around the country have always asked public health officials to do?
Public health historically has been under-resourced, understaffed. I think what's happened with COVID-19 is that the pandemic has really made clear the importance of public health. Everyone recognizes it now. And so there has been a shift. We did and have in fact gotten a lot more resources than we have had in the past. I'm here to tell you that it's still not enough.
Not enough.
I mean, if you look at something like testing, for example.
Yeah.
And this is not about Virginia. This is a national problem. It's a problem that stems straight from the federal government, right? So early on in the pandemic, we should have been really putting a lot more money, a lot more resources into developing testing, producing the testing kits, getting the viral medium together for transporting the test specimens. We should have been ramped up and ready to go. We were watching what was going on in China. We knew it was going to come, so let's get ready. And that wasn't done. And we've been playing catch up ever since. And that's been a real problem. The other thing I'll say is I'm concerned that once we do get on the other side of this pandemic, because we will at some point or another, I'm concerned that it'll go back to normal, right? Yeah. So we don't have to pay attention to that anymore. And the truth is before the pandemic came, public health people, whenever we talked about pandemics, we would always say, when the next pandemic comes, because it's not whether or not we will have one. We know that it's going to come. So we would say, when the next pandemic comes, well, the same is going to be true after this one, which means we have to be prepared. Mm-hmm. And so we already know from what happened in the response to this one that there are many aspects of it that we need to build up, and we need to do that once we're on the other side of this one. We can't fall back. We have to keep going forward.
Yeah, so really good question. And this is, kind of like, my area of expertise is healthcare reform, healthcare policy. The Affordable Care Act is something that I work passionately on from day one and still to this day. And so I know there's a lot of, talk about what's the next phase of healthcare reform. And I'm interested to hear your opinion about, expanding coverage. Is expanding Medicaid coverage sufficiently? I know Virginia has done it, but some states still have not. Is that enough to be able to deal with a COVID type crisis? What can we do to help people to be more resilient? So I'm just interested in your opinion around, policy that you think could be helpful for us to address disparities, inequities, and of course, even respond to pandemics. So your kind of thoughts on solutions.
I'm a big supporter of expanding health insurance coverage. The Medicaid expansion here has been really quite it's helped tens of hundreds of thousands of people. We have almost 500,000 people now who are new enrollees in Medicaid. That number increased over the course of this pandemic by almost 100,000. So yeah, really critical. I would like to see that expanded even more. There are tens of millions of people who are still without insurance, and they need that. And so I would support every effort along those lines.
You my man. I knew you were my man before, but you definitely my man now. Okay. So we got about 10 minutes left, and we've had a few questions come in. If others have questions, we love to hear from those. So Shani kind of framed up this question like she's gaining a lot of insight by sitting in this session, but she's asking, are there trainings or places you would suggest people to go to get a better understanding of social determinants, of health equity, race and bias, and how to be better servants in our community? So she's looking for tools to put in her tool belt to be a better citizen. And this is coupled with Liz's question. She says, I live in Danville, Virginia. They formed a health equity task force. What advice could she pass on to them? And how can we as citizens be better to improve health in our community or increase the opportunity for successful outcomes along that whole, all of the parts of that tree that we talked about?
Those are big questions. I think that as far as resources go, there are a number of organizations at universities and colleges formed around health equity or racial equity in general that provide readings and courses and that sort of thing. So I would look there first to see what you can find. Our website can lead you to some resources. Again, you can go to vdh.virginia.gov. We have an Office of Health Equity that through which you can also get a lot of these resources, and also look at some of the programs that they are running around health equity issues and get involved in that. The local health departments are involved with other community partners in doing initiatives around social determinants of health, and that would be another way to get involved.
Well, definitely, that's all great, helpful information. I want to kind of spend the last few minutes remaining going to two things that are really close to my heart and I'm very, very passionate about. And it actually ties back into the trunk of the tree, healthy children. So I'm a huge hip hop fan. And one of my favorite groups of all time is the Wu-Tang Clan. And everybody knows one of the best catchphrases from Wu-Tang is that Wu-Tang is for the children. And so for me, how we raise kids, how do we start them off with the best life possible is where we should all kind of keep our attention and keep our focus, because if children can grow up healthy, there's no telling, what we can do. So in this whole context of the trunk of healthy children, what would you say are some of the top things that communities need to be thinking about for kids? And what do we need to be thinking about to make sure that they have every opportunity to develop them in the right way? So is it early childhood education? Is it nutrition focus? I mean, I know all of them are important, but could you just kind of give some best practices, if you will, to think about when it comes to kids?
I think that from actually before they're born, even my belief is you can't have healthy babies without healthy moms. So we got to start there. We got to provide for and give the resources and support that are needed so that women who have children are healthy, and they will have healthy babies. Then, of course, we have to keep them healthy by providing them with the nutrition and so on that they need. Early childhood education begins the moment that baby is born. And I think it's really, really critical. And it's one of the real demerits of our educational system that so little resources are put into that aspect of it, right? So, childcare in general is not resourced well. And all too often, it's not really care, it's sort of babysitting, right? And what it really should be about is nurturing and developing those young people. It should be early childhood education. So those two things I would say would be where I would concentrate on.
Yeah, that's a great place to start. I'll just share a little personal context. Early in my career, I had the opportunity to do some child advocacy work. That was actually one of my early jobs. And I got a chance to do child watch visits all across the state and visit early childhood education facilities and understand brain development and gross motor skills and fine motor skills and all of those things. And then when my wife and I found out we were going to be parents for the first time, I was like, listen, I know this all starts before, our baby girl is going to be born. So you need to eat some green leafy vegetables. You need to eat lots of it, get some, vitamin D. You need to exercise every day. And it all starts before the baby's even born. But once that's happened, you really got to invest in the early years because, everything happens before year 3. 85% of your brain develops in the first couple of years of life. And so that's where we need to make our investments, which really raises a concern for me in the midst of this coronavirus and in the midst of this pandemic. I hear every day about people who, one, can't send their kids to an early childhood education center because of COVID. They're having to, take care of them at home, but they don't necessarily know all of what they should be doing and how they should be managing in this space. And it just kind of reinforces for me the power and the importance of us putting all of our efforts and energy to get beyond this coronavirus as fast as possible, and the importance of agencies like yours, leadership roles like you, to be able to address these issues. And so I'm confident that that you are the right man for the job in my home state, and we need more people like you. So
thank you.
I just want to say thank you and offer you the opportunity to give a last word before we turn it back over to the team who will take us, Ben, who will take us the rest of the way.
Thank you for those kind words, Anton. I really appreciate it. You know, I lead an organization of some 4,000 people, and I have to say it's really because it's so many great frontline workers in public health that we've been able to have the kind of success that we've had. And I also think Virginians have responded well to the message that we've put out. People have been wearing their masks. They've been, you know, washing their hands, maintaining that social and physical distance. And I think to the extent that we keep doing that, we're going to be able to get beyond this pandemic. So I think keep it up, and we'll continue to give you the advice and guidance that you need to make it through. Awesome.
Thank you so very much, Dr. Oliver. It's been a pleasure to host and moderate this Vital Signs with all of you. And I want to thank Tom and Goodstock for the opportunity for me to be here and participate. Y'all be great. And I'll turn it back over to you, Ben.
Yes, thank you, Dr. Oliver, Mr. Gunn, for sharing your insights and perspectives with those of us here today. I think it's these kind of resources and perspectives that are really what people are looking for. So we're excited and grateful to you both and to everyone here today for being a part of this. If you enjoyed today's session, please consider becoming a contributing member to our foundation so we can continue to do this work in the future. You can do so at tomtomfoundation.org. And we hope that everyone here will join us at future programs at the Cities Rising Summit. This whole week is focused on equity and community health. And, you know, I was reminded of a session that we had this afternoon, Dr. Oliver, when you mentioned that you can't have healthy babies without healthy mothers. We've got a panel discussion at 4 talking about the crisis that's facing Black mothers with 4 incredible doctors, Joya Creer-Perry, Ebony Hilton, Rashonda Mitchell, Kanasha Gleaton. So we're thrilled, and following that also there's a meet and greet for folks who are interested in learning more about social determinants of health and connecting around these issues. So we'd like to thank our sponsors as well. As a last note, without their support, none of this will be possible. And today's session was brought to you by the Hartfield Foundation, as well as Goodstock Consulting. So we thank you again, and see y'all soon.
Thank you.
The day of reckoning is finally here. No justice, no peace for too many years. We're marching for equality in every state, choosing love over violence, brutality, and hate.